Plain abdominal X-ray can be seen. Free gas in abdominal cavity below diaphragm. You remember?
No.
Perforated peptic ulcer.
Oh.
Or perforation of the whole organs. And intestinal obstruction. Intestinal obstruction. Do you remember?
Yeah, you can't see.
Levels of the fluid and gas. Cloiberg's cup. Cloiberg's cup. You remember?
Open the book.
Talk about the patient more. You are
Worried.
don't be in a hurry. About the patient. Can be patient with the disease of the vessel.
Very close.
Very close vein, it is very easy, да?
Yeah, right.
You will see. Thrombophlebitis of the varicose vein, it is easy too. You will see the veins, hardness, tenderness, redness along the curved vessel. Thrombophlebitis of the deep veins. So will be edema of the leg, of the foot and the calf and the tenderness on palpation. So this is thrombophlebitis or post-thrombophlebitic disease, post-thrombophlebitic syndrome. Так, what else? Artery. No, artery, the most, what the etiology? Atherosclerosis, atherosclerosis obliterans, да? So, claudication, intermittence, да? Claudication, intermittence. You remember?
Yes.
The walking.
You can't walk.
Walking, after that
Painful.
stop due to pain, after that walk again.
Yeah.
So this is. And перемежающая хромота. Перемежающая хромота. No other signs. Objective examination. Pale, the leg is pale, skin and thin, and no hair. And did you understand? And you should know where palpate the artery. Do you remember?
No.
Oh, very good. So, arteria tibialis posterior. Where is this? Arteria tibialis posterior. Malleolus medialis,
behind
1 centimeter behind.
Okay.
So, arteria tibialis posterior. Arteria dorsalis pedis.
That one we know.
To the first,
Like the big toe.
between first and the second toe, the line to the middle part of the, between the malleolus. Middle part, line to the first space between the toe. So on this line should be artery. Arteria poplitea, да?
Yep.
No, it is clear, да? Deep in the popliteal
Popliteal
fossa,
fossa.
да? And the femoral artery. Femoral artery. Where is the femoral to find?
Above the...
It's in the middle.
Plica inguinalis, and the middle part below plica inguinalis. Middle part, plica inguinalis. Spinaliac anterior superior, tuberculum pubicum. This line. So below this line, middle part on the femur.
Right on your
Clear?
Got it.
Did you understand?
Yes, sir.
So artery, you should know how to palpate the artery.
Got it.
So only the lower limb artery or upper limb also?
Upper, very rare. No patient like this. No, I hope you remember where is the radial artery, the
Brachial artery.
humerus artery.
What other questions will you ask?
So if we get this.
Так, appendicitis, cholecystitis, pancreatitis. Pancreatitis. Какие? So, belt-like pain, yes. Опоясывающая боль. Radiation to the back. So
Pancreas.
pancreatitis. Curte signs. Curte sign. So this is tenderness and muscle rigidity in the epigastric region.
Yeah, Curtis.
Yes. Shafar zone. Do you know
Yeah.
Shafar zone?
No,
Yes.
it's not here.
No, it's a zone. It's not like never mind.
Costal margin, umbilicus, two vertical and the line through the umbilicus, bisectrice. So, and this zone is called Shafar zone. This is projection of the head of the pancreas on the anterior wall. Now,
Right side.
yes? No, Colin signs, you remember? Colin signs and как вот там дальше? Colin and
Cullen sign.
great
Eternal.
turner. Discoloration. Hemorrhagic discoloration of the skin around the umbilicus and the flanks, on the flanks, due to hemorrhagic pancreatitis.
This is
Turners, grey turners.
great and
Okay, what else?
hemorrhagic discoloration of the umbilicus.
Around umbilicus, Colin, да? And grey turner flank, on the flanks. So this is bad prognostic signs. Hemorrhagic
Great
pancreatitis.
Turner.
Grey turner. Так, what else?
Cullen's
Воскресенский sign. I told Воскресенский too. So it is for acute pancreatitis.
Away from the
So this is when you palpate at the epigastric region, absence of the pulsation of the abdominal part of the aorta. Epigastric region, left side, absence of the pulsation of the abdominal part of the aorta due to mass, due to inflammation. So impossible to palpate because the pancreas enlarged, mass, and so not possible to. Absence of the pulsation of the abdominal part of the aorta in the epigastric region. Mayo-Robson signs. Mayo-Robson. Clinical Mayo, знаете, clinic of the Mayo. Mayo-Robson signs. Tenderness on palpation of the costovertebral angle on the left side. Costovertebral angle on the left side. This is projection of the tail of the pancreas. So, costovertebral angle on the left side. So, this is stuck. Вот. No, this is in the rebound tenderness and so on.
So do
In
we
the
have to
signs
know
of the peritonitis.
for intestinal obstruction and also for like stomach ulcer, duodenal also? Also?
What?
Also. For the signs for those as well.
Signs of the...
Intestinal obstruction and the ulcers.
No, we are not asking about special signs. There is special signs, but usually we are not asking special signs.
Great, thank you.
If you want, if you ask
Appendicitis.
specially, I will answer.
No, it's fine.
So you should know distension, vomiting, and so on. Intestinal dehydration, pain, characteristic of the pain, and so on. Intestinal obstruction. Так, what else?
What are the main pathologies? Cholecystitis, appendicitis, pancreatitis?
Differential diagnosis.
No, I mean for like what are the patients in that hospital usually have?
The same patient like it here and there, the same. Emergency patient the most often. So, acute appendicitis, cholecystitis, cholelithiasis, the pancreatitis, intestinal obstruction, rare more perforated peptic ulcer of the stomach and duodenum. Sometimes disease of the colon, like diverticulitis, ulcerative colitis. So this is the disease, and the disease of the vessel, atherosclerosis obliterans, varicose vein, thrombosis of the deep vein, thrombosis of the superficial vein. So this is the patient.
No hernias.
Hernias. No,
Yeah.
hernia will be post-operative.
I hate hernias.
Post-operative period. What can be incisional hernia, inguinal hernia, femoral hernia, umbilicus hernia. So this is
Hate hernias.
your favorite question.
No, I
Hernias,
hate it.
Yes. Так, clear?
Clear.
Так, what else?
Anything else we should do?
А?
Ultrasound X-ray.
Ультрасаунд, X-ray. Давайте немножко покажу вам.